Shall we start with our first talk, which will be delivered by Laura?
Thank you very much, Eileen. Welcome, students, to this overview about the Biomedical Science programme here at the University of Birmingham. So the programme is taught within the medical school, and the medical school is situated at one end of the university campus. And one of its strengths is that it is surrounded by research institutions, which allows our students during the programme to interact at all times with both the top level researchers and with our clinical fellows who are in the largest hospital at the QE, which is close to the medical school. The programme is in the College of Medical and Dental Sciences. And when you study biomedical science, it's all about understanding how the human body functions, both in health and in disease. We need to understand, first of all, how all of the processes happen. Once we understand the mechanisms, when anything does go wrong during a disease state, we are able to then provide a clinical intervention that allows patients to recover much more quickly, reducing any side effects. It's very much a science degree programme and very research orientated. The research is aligned to the programme strengths across the college, and so you will be taught by world leaders in their respective fields. Your teaching will be research informed, it is always current and very inspirational. And if you think about what is going on in the world right now with COVID-19, biomedical scientists are fundamental in understanding this disease. We need to understand how it is being transmitted, how to develop a vaccine, and more importantly, how to provide this vaccine in a safe and clinical way. So we're interacting all the time with our clinical partners. And to be a biomedical scientist, you have to be curious at all times. You have to wonder, why is that happening? And what can we do to make things better? So in order to keep the research strengths, the International Centre for Biomedical Research is attached to the medical school, and our students spend much time there, especially in their final year. The IBR has been able to generate £300 million of live research funding, with over 80 million coming in the 2019, despite the hard economic climate. This shows that our researchers are internationally competitive, and you will be given the opportunity to work alongside them. This means that we have a focus that integrates our research into the programme. And I think this is really important for students to understand. You're not just going to have didactic teaching, you are going to be the researchers of the future. And so we need to develop your skill sets very early on. And by interacting with these people, you begin to pick up extended knowledge that you didn't even realise that you needed. So how will you be taught? So across years 1 and years 2, we have a plethora of different modules which takes you from the molecular and cellular part of the body all the way up to whole body systems. Now it's important that we understand the molecular and cellular levels of any process, because changes at a molecular level can change the cellular interactions, which then can lead to miscommunication throughout whole body systems. If we understand how this changes during a disease state, we can use pharmaceutical interventions. And because we understand the normal signaling pathways, we can predict how these pharmaceuticals will actually take effect. And this is driven throughout years 1 and years 2. We also have a personal academic development portfolio that all students undertake. And this, I believe, is really important for students to engage with. Within the personal academic development modules, you actually integrate with our careers network. This means from very early on, we are helping support you determine what your next pathway will be. And it starts very early on in year 1. We start exposing the students to the different pathways they might want to take upon graduation. Our careers network team are incredibly supportive of our students, helping them with making good CVs, interview practice, so that our students upon graduation are very competitive. The course structure is such that you will have your examinations at the end of semester 1 and semester 2, very close to the learning that you have had in that previous semester. But you also get the opportunity to have an enrichment week. Now this means that you can go anywhere on campus across any department and actually take place in different workshops. This will enhance your communication skills. It will also allow you to follow a track that you were interested in, haven't had an opportunity to do, but now during this week after your exams, you get a chance to try something different. So this takes you away sometimes from the hardcore science, allowing you to develop your creative skills. But the programme also puts on stuff during the enrichment week, including post-exam lab practice, especially at the end of year 1. And this is to help students become more confident when they're working within the lab setting. At the end of year 2, we fund students to go to France and to China, and they spend a month in these countries doing research with our industrial friends. And so this means that you're actually going to be seeing how research and science is done in different countries. This too is an amazing experience, and it's fully funded by the programme. Some students take the option to take an industrial placement at the end of year 2, and this is important for upon graduation. If you do decide to take an industrial placement, you will be supported throughout the process by our colleagues in the careers department. In year 3, you get your chance to specialise. This allows you to decide which area of biomedical science are you interested in. And so you can choose from a multitude of different option modules. Over years 1 and year 2, you will have been exposed to all of this in bite-sized bits. Now it's your chance to decide, what am I most interested in? And you will specialise in this module, and it will run and be celebrated at the end by a big poster event. You then go on to do experimental data interpretation, and this is to enhance and ensure that all students are confident in handling large data sets. In particular, we refresh students on the statistical analysis that is required. This happens just prior to the capstone experience, which is your research project. The research project runs for 10 weeks in semester 2. You get to choose a choice of different research projects, and this research is novel and often leads to data that is used in published scientific journals. Your research project is full-time, so you get to integrate yourself into the research groups, and you have incredible support with one-to-one supervision from our international collaborators. This enhances your problem solving and your analytical skills. We offer a range of different research projects. We appreciate that not all students are going to want to go down into the laboratory-based areas, and so we offer different types of research projects. Perhaps you're still or maybe wanting to go into medicine. Here you could undertake a research project in clinical and community-based projects. This means that you will integrate yourself into the QE or into the medical school, working with our clinical colleagues, looking at the different aspects maybe associated with a particular disease. Perhaps you're interested in going into teaching following the biomedical science programme, so you may undertake an educational project. This allows students to actually do part of their projects within schools. And finally, we have the business projects. The business projects are aligned with Reckitt and Benckiser, the largest pharmaceutical company in the world. Now, Reckitt and Benckiser partner us both in years 2 and in years 3, and allow students to try a different approach Perhaps you want to go into the pharmaceutical area. If you do, then taking a business project will actually get you to understand the different elements that it takes to bring a biomedical product to market. The final part of the programme involves the global challenge, which really enhances students' ability to work within a team. All teams will be given a challenge that they have to find a solution to, but instead of the rote final exams, this time the students are going to be asked to produce an audio-visual podcast. This allows students to be creative and innovative. You're going to be able to communicate science to the wider community, and this is really a strong strength that you will have created across the 3 years. You will have developed your scientific writing, and you will be able to write to different audiences. And being able to communicate with different audiences, especially when dealing with science, is a crucial skill. The course is structured in years 1 and year 2 such that you have approximately 20 contact hours. It will vary week on week. We enhance our lectures with small group teaching sessions. These small group teaching sessions allow students to come up with problems that they may have had that can be answered by a tutor. You will also have practicals running throughout years 1 and year 2 to develop your core competencies. In year 3, the contact hours are slightly less. And the reason for that is now we are developing your independent learning, giving you time to really embrace yourself within the research area that you're interested in. We're also very excited that we have been given the go-ahead to promote the undergraduate masters in biomedical science. And this means that for this year, students could embark on either registering for a 3-year BSc or for a 4-year undergraduate masters. The years 1 and year 2 will remain the same. And instead of doing the year 3 as I have just outlined, the students undertake 2 slightly different modules. The first is in scientific writing, allowing students to understand the different style of writing for different research journals. The translational research module really now gets students to understand the difference between basic research, which we do often within the labs, how we have to then use legislation that we must comply to ensure safety for the patients. How does the research change from this basic research science to the translational? So we are truly taking the students from the bench to the bedside. And at the end of this module, students will receive the Good Clinical Lab Practice Certificate. Students then may take an optional year out and then rejoin the programme in year 4. In year 4, once again, the students get to choose an optional module. Depending on which options the students have chosen in years 3 and 4 will allow them to go then to the IBMS for accreditation. The students then do an extended research project. This gives them more time to really understand the complexities and the enjoyment of being within these areas. We always reward excellence on the programme, and in particular we have the Sir Arthur Thompson Overall Achievement Award that's given at the end of years 1, 2 and 3. But whatever your interest in, there are prizes that actually acknowledge the excellence within those fields. Our key metrics over the last year have shown that 93% of our students are really happy with the programme. And the one thing that we are always credited with is listening to our students. We take on board what students are saying, and we try to incorporate these changes as we move forward each year. We're particularly proud of having won 2 awards for the Year 2 module, Student Science Selected module. And this is because we have aligned ourselves within the industrial placement side. Now, it's really important for us that we developed the 3SP, which allowed students to do a business and enterprise module. This business and enterprise module gave the students for the first time a chance to be entrepreneurs. And as I said, by linking with Rickert and Benckiser, we are incredibly fortunate that we have developed our students' skills to think outside of just biomedical science. The degree is accredited by the Royal Society of Biology, which is given following an independent and very rigorous assessment. And this accreditation states and prepares our students to address the needs of current employers. And so we change the degree to ensure that our students are the most competitive. We ensure that our students have met all the learning outcomes associated with the biomedical science benchmark and show that they have extensive subject knowledge, technical ability, and have these transferable skills. Following the change to our careers destinations, we now look to find out where our students are 15 months after graduation. We can see now for the first time that our students remain high in their employment. They are 97.2% employed with 74.2% in graduate level jobs. Some are studying or doing PhDs or have moved on to do medicine. We have students who go on to do science journalism or work in clinical trials. But this degree will also open many doors for you. And we have students who go off into the finance world or into clinical administration. Your Birmingham offer is individual to you, and it will take into account your GCSE results and any subjects that you'll follow, any other subjects that you're studying. To find out more, you can use the offer calculator on the website. Our standard offer is AAB, and if you offer us an A in the EPQ, it's reduced to ABB. You are required to take 3 A-level subjects, 2 sciences in biology, chemistry, maths, or physics. The third can be non-specific and can include the Welsh Baccalaureate. We do advise biology, but it's not compulsory. Your GCSEs, you must have taken maths, biology, and chemistry and achieved at least a grade B. If you're taking the International Baccalaureate, you must have achieved no less than 32 points overall, and to include 2 sciences. We also offer alternative offers. The contextual offer depends on your school performance and postcard and is reduced offer to ABB. You may join our programme through the Access to Birmingham or the Realising Opportunities programme, and here you need to achieve 3 Bs. We will give you an attainment offer if you're predicted 3 As or above and one of your A-levels includes biology. You need to have 8 GCSEs, 3 at A star and 7 at A. If you're taking the International Baccalaureate, you need to be predicted 32 and it must include 2 science subjects. In order to get this attainment offer, you must firm with us and attain a minimum of C at your A-level subjects. Students often worry about their personal statement. What are we looking for in your personal statement is about you. We use your personal statement so that we can actually help support you upon arriving at university, but we do not use it as part of our admissions process. So students, if you are planning on going for medicine and are worried about what your personal statement would be if you are putting biomedical science as your 5th choice, then do not worry. Write your personal statement for the medicine programme. If you are applying just for biomedical science, then in your personal statement, let us know about what motivates you. Why do you want to do a biomedical science programme? And tell us a little bit about yourself. What extracurricular activities are you interested in doing? You can apply for the programme using the B900 code for the BSc Biomedical Science programme. We will be shortly advertising the code for the Undergraduate Masters Biomedical Science. Our admissions tutor, Dr. Andy Coney, can help advise and give plenty more information on what it's like and what the admission criteria is to apply at the University of Birmingham. And I do urge you to go and have a look at the website to find out more information about our modules and the teaching within the programme. Thank you very much for listening, students.
Thank you very much, Laura.